everybody, this is Dr. Daniel. Today I'll be talking about a condition called melasma. It's a fairly common condition that affects the Asian population perhaps a little bit more than other populations. And this condition is often considered a benign condition, but quite often the effects in terms of the social as well as psychological aspects can be more than just a slightly benign influence. So today what I'll be talking about, I'll be touching on briefly about some of the causes of melasma and the treatment options that we have for melasma. And I'll also be talking about some of the more neglected aspects of melasma treatment that I think sometimes is forgotten about. So let's begin. So melasma itself is a multifactorial condition. It is influenced by genetics. As we can see, the Asian populations tend to get it a bit more. It's also influenced by hormones. We have noticed that people who are pregnant are also at a slightly higher risk of getting melasma. It's also certainly influenced by gender. It's much more commonly seen in the female population, although males sometimes do get it as well. And as well as age. Melasma tends to appear around the middle ages for most people. Beyond that, there's also sun exposure. That is also quite an important factor as far as development and the worsening of melasma goes. So what are the options that we have for treating melasma? Well, just like it's a multifactorial condition, it's also a multifactorial treatment approach as well. So most commonly, there will need to be some brightening agents involved. So these include topical as well as energy-based devices to help to brighten the skin. So from the topical point of view, we have things like Triluma, which is a triple therapy cream that helps to brighten the skin. In terms of lasers, we have things like the Q-switch laser or pico laser. Those are fairly commonly used to help to either suppress pigmentation or break up some pigmentation caused by melasma. Beyond that, other options include chemical peels, although those are slowly falling out of favor because of the lack of control compared to a laser treatment. Beyond that, of course, there are oral options as well. Things like tranexamic acid can help to reduce melasma by reducing some of the vascular factors that could be causing the increase in the factors that influence melasma pigmentation. Other than that, of course, because sun exposure is a cause of melasma worsening, one of the things that we do need to ensure that patients do comply with will be a sun protection, ensuring that regular sunblock use is also an important aspect of melasma treatment. So these are some of the fairly commonly used and basic aspects of melasma management. Beyond that, I think something that's quite often neglected in treating melasma is the patient education or patient experience itself. Quite often we focus a lot on what are the things that we can do to treat melasma, but we forget about what the patient experience is like, and that itself is an important factor in all kinds of treatment, not just melasma, but because melasma is a chronic condition and that tends to be not totally resolved with treatment. They tend to, it's a condition that we try to control, try to reduce and minimize, but it's very rare that it's totally resolved. So I think above all else, all the treatments that we have available, something that we need to also emphasize is patient education as far as treating melasma goes, and emphasizing that melasma is a chronic condition, and that to also moderate expectations about what kind of results to be expected for melasma treatment regardless of the modality. And that's all I have for you today. Thank you for watching.